are working. The other ones, they bypass water. You can't bypass water like it's electricity. It's not like it's a current going through there. In water, when you switch off, to recharge the system, it takes hours. 1 hour might be equivalent to 7 to 8 hours, depending on how the system is big. Then the tools of trade. Where I sit right now, if we implement these reforms, what the president is going to unveil as a response plan from the Water Crisis Committee, covering all the provinces and leaving no one behind. The stabilization on the indicator, it will take about 3 to 5 years. The system will remain vulnerable. There will be nothing wrong that the system must be vulnerable. The issue of stabilization is our first point, and then the issue of going to the next level and be able to optimize it. That should be our approach. Then that indicator of non-revenue water, Sompisi, if you attend to the asset, invest there, the money is there, the institution is there, then you bring the people. When you bring the people, they must have the tools of trade. I went to Johannesburg, and many municipalities, including metros, guess what? They don't have a warehouse. That if this pipe is gone, I'm able to get you to the store. This, what do you call it, a pump, whether this particular valve, then there's a culture of those who are working there. You know what they do? You report a problem like we are saying. You report it, they come during the day right now. And then they will not fix the problem. They will come after 4, then they started to claim an overtime. And then the issue of culture, attitude, holding each other accountable will be that. But I'm very pleased, I'm on record, what Sean and the team and the president is putting there, if there's a buy-in by local government and provincial government, also buy-in that we've brought in private sector for the first time. We're bringing experts and civil society because government alone has no monopoly of wisdom to resolve the water problem. We just stop the politics and ideological issues to say, yeah, we are bringing in private sector, we are privatizing, this government is neoliberal. Those are some of the issues. We're at a stage where we need to harness the whole capacity that sits within our society, within various sectors, just to be able to ensure that water is sustainably delivered to all. Thank you.
Mbangazita, as you can see, the chair is reminding me that my time is very limited. So in the interest of a constructive engagement, we will request that perhaps as part of the supplementary responses, we also then place some of these commitments. You are committing yourself, DM, to say then that as part of these commitments and as part of the response, these are the other issues that I had wanted to address. Just in the interest then of a holistic approach. The last question I have, Chair, relates to the blue and green drop reports. We are expecting the next iteration of the blue and green drop reports end of March, DG. And I hope we are ready for the upcoming report. We don't want to preempt the findings, but we are interested to know if we can expect improvements, particularly with regards to the interface between the right to water as well as the right to food. So let me frame my last question in this way, DM. I'm looking at the last report, which is both reports, 2023, which revealed that 46% of drinking water systems had failed the microbiological standards. Similarly, 64%, I'll wait for you, DG and DM, so that you don't miss the question. 64% of wastewater treatment plants were either in high or in critical risk of discharging raw sewer. Now, given this reality, the question that this inquiry would want to know is around contamination carryover, or what scientists call pathogen transfers. how much of the pathogens that have been found by both the blue as well as the green drop reports are transferred to the fresh produce, particularly in the informal market that has limited access to water? I'm talking about street traders of fresh produce in particular, in rural areas and in townships. How much of that fresh produce is at risk of contamination? That is my last question, DM. Thank you so much.
Ugcina ngenzima kakhulu Sompisi. I must be on record. We have not conducted the study in terms of the impact. I know because sometimes that sector, Sompisi, is not regulated. You know, for an example, if you look at our commercial farmers, and you look those who are exporting. Remember the World Trade Organization, there are issues of health and hygiene standards. And if your produce is not on a particular level, you get kicked out. I know in the Western Cape, it was always the biggest problem for the citrus teams. But at a level where people are most vulnerable, especially those particular sector, it's a matter that we'll discuss with yourselves, including other experts, including our Water Research Commission, that we need to do that. Because there are areas where we make the law. You know what? Every water that you release, whether what you call it, effluent or brown water, whether the raw water, we must test it. But our monitoring in terms of the testing of that particular water and our monitoring system is not reaching all these other areas. And we're trying to increase. But it's a new area that we need to study because there might be people that silently were killing because there are no instruments to check. Uthatha amanzi kuphi lo, and then from there, what daisa le cabbage like and a tomato, and then what is the content that is there. But I know in the department and in the state we have not gone to that level. But for commercial ones, because of the stringent condition in terms of SAPS, but also in terms of the WTO, very, very high standard. But our norms around the SANS 241 and the other SANS, we're tightening them because remember there are new contaminants that are coming into the streams. And we still have to look at the volumes and the impact. Thank you.
No, thank you. This is not a question, DM, but it's something to note. If the standards are high for the commercial producers and less for the informal market, it increases the vulnerability of small-scale farmers to be able to enter the market due to lack of access to water and exposure to contaminated water that is contaminated with pathogens. So just something to note, it becomes very important then for us to ensure that the water that is accessed by small-scale farmers is also free of those pathogens. Thank you so much, Mpangazit.
Thank you so much, Commissioner Ntuli. Deputy Minister, I am covered by the evidence leaders as well as the panel. Thank you so much for availing yourself. In terms of the supplementary submission, it has been requested that you provide us with the it is in terms of the breakdown of the statistics in terms of the provinces. Is that correct, Prof? People relying on water tankers in terms of the provinces as well for the last 5-year period. And I think that is the only submission. If you're able then to provide additional supplementary submissions to the Commission in terms of your deliberations with the evidence leaders as well as the panel, you're more than free to do so. Kindly do so on or before the 6th of April 2026.
Chair, Prof, we will want to assist, but it's practically difficult because the ownership of that asset lies with local government. We can be able to try to check the correlation around the ownership of the tankers in terms of non-revenue water. Because remember the non-revenue water, there's a physical losses in terms of the conveyance. There's a non-revenue water on the basis of tankering. There's also non-revenue water because of illegal connection and vandalism. And then to look at the issues of disaggregation We'll try to ask so that we can see. Because at least we know when it comes to physical losses and then the other losses that are there. But we have not actually broken it down to that level. But as a policy matter, tankering is an alternative and a temporary measure. And in many instances, it has become a permanent feature. Secondly, it has exposed people to abuse. Women are abused and girl children ask for sexual favors just to buy water. The water is being sold. That's one of the issues that is being happening. It is so erratic, unreliable. Then the issue of quality. You know, in certain instances when we do sport monitoring.
Minister, you're going to now, because you're such an expert in this area, you're going to take another 10 to 15 minutes explaining.
My
And then
apology.
your next colleague, the Minister of, is it Planning, Monitoring and Evaluation, will say, Commissioner, why did you take so long?
Thank you so much, Commissioner.
Thank you so much. But I think perhaps you can also just engage in terms of the written submission. Deputy Minister, you're excused. Thank you.
Thank you so much. We wish you the best. We will invite you to the launch of our drop report end of the month.
Thank you so much. We then are going to ask, in terms of the chef's essay, who are
Yes,
joining
good
us,
afternoon, Commissioners.
who are joining us online. Can I kindly just ask you just for a moment to switch on your cameras? Thank you so much. I see that there's only one representative that is joining us in representing Chef's essay. Just for brief introduction, just introduce yourself as well as the role that you play at the organization. Okay, there's two. Thank you so much. I see now that there's three. I think we'll just have one representative doing the introduction as well of the three colleagues, and then after that I'll swear in the individual colleagues.
Thank you, Commissioners, and members of the panel, and anyone watching and listening. I'm Suhaifa Bamji, and we're representing Chefs South Africa, the Sustainable and Healthy Food Systems. We are a Wellcome Trust-funded interdisciplinary program based at the University of KwaZulu-Natal. We integrate nutrition science, public health, socio-legal research, environmental science, and constitutional law.
Colleague, apologies for this. I see that there are people just walking into the room. Can we just give them 3 minutes to walk in the room swiftly? Can you get on because Abigail, Tam, if we can assist in facilitating this process so that we move with a bit of speed.
I'm Jabu.
Thank you so much, and thank you so much to our colleagues for that, allowing that brief understanding and their patience while we had to proceed with the other other stakeholders, which just adjusted our program. I'm going to hand over to one representative who will then quickly introduce the colleagues, and then we'll take it from there.
Thank you, commissioners and members of the panel. My name is Suhaifa Bamji. This morning I'll be speaking on behalf of Chef South Africa. Together in our team is Dr. Laurentia Govender, Dr. Beulah Mutondotsa, Professor Njabu Ngidi, and Professor Rob Slotto. Chefs SA is a sustainable, healthy food systems, and we are a Welcome Food Trust funded interdisciplinary program based here at the University of KwaZulu-Natal.
Thank you so much, Dr. Bamji. I just wanted to ask, I don't know if it's IT, if we can just spotlight the representatives as introduced so that I can just start the process of either affirming them in or swearing them in. Thank you. It looks like there are 3 colleagues that have their cameras on. We'll start with yourself. Dr. Bamji, will you be taking the prescribed oath or affirmation?
I'll take the oath.
Do you consider the oath to be binding on your conscience?
I do.
Do you swear that the evidence you're about to present before the commission is the truth, nothing but the truth? If so, raise your right hand and say, "So help me God."
So help me God.
Thank you. We'll then move to Professor, is it Professor Ndiki? Ndiki. You are muted, sir. Please help me also pronounce your surname so that I get it right.
Ngiti.
Ngiti. And it's Professor.
Yes.
Your title is Professor.
Yes.
Will you be taking the prescribed oath or affirmation?
Oath.
Full names for the record.
Jabliseni Simon Klopas Ngiti.
So do you swear that the evidence you're about to present before the commission is the truth, nothing but the whole truth? If so, raise your right hand and say, "So help me God."
So help me God.
Thank you. The last representative that I have on camera. So full names for the record.
Professor Roberts Hugh Slaughter.
Professor, will you be taking the prescribed oath or affirmation?
I'll take the affirmation.
Do you consider the affirmation to be binding on your conscience?
I do.
Do you affirm that the evidence you're about to present before the commission is the truth, nothing but the whole truth? If so, raise your right hand and say, "I affirm."
I affirm.
Thank you so much. Is there a third colleague, the fourth colleague, or is it just the 3 of you?
Yes. Laurentia.
Yes.
I am on and I am showing my video. I'm not sure why you can't see my video.
Now we can see.
Now we can see.
Can you see?
Now we can see
Oh, okay.
you. Yes. Can you kindly introduce yourself?
I'm Dr. Laurentia Govender.
Doctor, are you going to be taking the prescribed oath or affirmation?
I'll take the affirmation.
Do you consider the affirmation to be binding on your conscience?
I do.
Do you affirm that the evidence you're about to present before the commission is the truth, nothing but the whole truth? If so, raise your right hand and say, I affirm.
I affirm.
Thank you so much, colleagues. You have 20 minutes, so you have until 12:46. Thank you.
Thank you, Commissioners. I've already given the introduction. We are Chef South Africa, and we are focusing on the issue of the child's right to basic nutrition, focusing on the science involved with the 1,000-day food voucher intervention. So a little bit of an introduction. At Chefs, our work is transdisciplinary by design. We bring together science, law, public health, and community knowledge to understand how climate change affects health through food systems, and to translate that knowledge into scalable, high-impact policy solutions. We are building a global South-led community of practice. This network applies systems thinking within an expanded climate-sensitive chef's framework to strengthen food security, food safety, nutrition, and overall health, including mental health. And finally, we're establishing a global South cohort program to train the next generation of scholars and practitioners in transdisciplinary climate health research, ensuring long-term capacity and leadership. Our purpose today is simple: to assist this commission with a constitutionally grounded, scientifically supported operational plan immediately realizable, and immediately to realize the children's right to basic nutrition in a very focused frame, the first 1,000 days of life. Why are we here? Well, with our transdisciplinary work, we aim to close the gap between rights, science, and delivery. Chef South Africa works at the intersection of two domains that are too often kept apart: constitutional rights and jurisprudence, and scientific data, nutrition evidence, and real-world system design. In this submission, we deliberately bring these worlds together, closing the chasm between theory, practice, and reality, because constitutional rights cannot be realized on paper alone, and science cannot protect children unless it is translated into enforceable programs. And this is exactly what we present today. The biological window of reversible harm.
Apologies,
Now,
Doctor. Can we kindly just ask if you can share your presentation? We were seeing it, but
I
now
was
we're
sharing. Oops.
Yes. Thank you.
Apologies, I was sharing. I think it is. Can you see it now?
Yes, we can see it.
Okay. So why are we looking at the first 100 days, and why does it 1,000 days, and why does it matter? So the period from conception to 24 months old of being born is the most critical developmental window in human life. Nutrient deficits here cause permanent and reversible physical and cognitive harm. South Africa's national stunting rate remains extremely high at 27.4%, driven by persistent micronutrient deficiencies and inadequate maternal diets. And we will speak later. Dr. Governor will speak about the child support grant at 560 Rand and what that means. But what we see is, as it is involved in after delivery, after birth, the food child support grant does not deal with children that are in utero. So it does not support pregnant women while they are pregnant. And we are focusing on that 9-month period while the child is in development. Now, there is certainly a constitutional argument to be made that these rights only realize after the child is born and born alive, but that is not entirely true. There's strong enough an argument to be made that the best interests of the child, particularly during the period of laity, also is involved, and we can draw on the successes related to the prevention of mother-to-child transmission, treatment when it comes to HIV. So the current social protection window, as I've explained, falls outside of the 1,000-day window. And what we want to do is bring it into that frame, particularly in the first 9 months of a child's life. And we will talk about that a bit much later through Dr. Govender. To focus more on the constitutional issue, which is what my task here today is to make constitutional arguments that this is not something that is progressively realizable. It is immediate and must be done now. We draw a distinction between Section 27 of the Constitution, which considers the right to access to, and that largely brings into the frame adults. But then, of our immediate focus, are children. And we bring into frame Section 28(1)(b) and C of the Constitution, which deliberately and very specifically says that a child's right to food is immediately realizable. And this deliberate constitutional hierarchy is what we are focusing on as part of our submissions. Has this been done before, where the child's immediate right has trumped what might be understood as progressively realizable based on infrastructure or even financial or budgetary constraints? Yes, it has. We've got precedent in the Grootboom case, as well as the TAC number 2 case. And those provide sufficient background for why this is another avenue through which the child's right can be immediately realized without having to wait for more paperwork, more delays, and more politics around whether or not children should be given the nutrition they deserve in terms of the Constitution. To bring this within the frame of the 1,000-day nutrition program, a child cannot breastfeed safely, nutrition dense or access nutrient dense food or develop healthily unless even the mother or caregiver is also supported immediately. And that brings us again closer to the discussion of the Grootboom precedent. In other words, where we are going with our arguments on the constitutional aspects is that providing nutrition for the unborn child through the mother actually sees a realization of a broader interest where families are, or at least the parent or the female parent, the mother parent of the family is also receiving nutrition and health. And so there will be much more to gain in a positive frame for that. But the reality is that a child unborn cannot access any of this nutrition unless via the mother. The indivisibility of rights. Now, this again, nutrition cannot be siloed, and we can't slice it up into a little bit here and a little bit there. Section 28 of the Constitution must be read with the right to dignity in Section 10, the right to health care in Section 27(1)(a), water and sanitation in Section 27(1)(b), and the right to environment in Section 24. We bring also into the frame that dignity is not just a listed right in the Constitution, it is the basis and the foundation and the framing of everything that the Constitution stands for. A siloed intervention is therefore constitutionally defective. Only an integrated system can satisfy Section 28 and the overarching principle of the constitutional framework of dignity. So to bring into the frame what the Commission has said about historic injustice, the Commission's framing is absolutely correct. Child hunger in South Africa is not due to food scarcity. We can provide statistics related to the amount of food available in the system. It is the product of historic injustice, structural inequality, and spatial deprivation. The first 1,000 days are where these injustices become biologically entrenched. Failing to intervene here deepens the intergenerational cycle of poverty, which is why the Constitution treats this period with such gravity. We can draw examples or draw success from our KZN or some KZN case studies, which provides evidence of systemic failures and what it could mean. So we're looking at the Ngundlovu district case, which Dr. Governor and other colleagues can give more insight on, but it related to issues of adolescent pregnancy, household food price pressures, insufficient grant value, weak breastfeeding support, fragmented wash and environmental health services, overburdened healthcare workers. We have looked and in some instances at Lifeline Pietermaritzburg, where their outreach program related to pregnant teenagers in local hospitals has demonstrated some success in reaching these young women and young mothers who are still in the period of laity. And we would propose to make distinctions and even parallels with what can be achieved if we were to apply the principles in Grootboom as well as Treatment Action Campaign number 2. Our remedy that we're proposing is the 1,000-day delivery architecture, which is designed to meet Section 28's immediate standard, systematizes localized excellence at a national scale, and moves from theoretical rights to measurable impact and households. Our ask of this commission is simple, but I will hand over to Dr. Laurentia Govender, who will present, and I will intervene at the end just to give you our final wish list. Hand over to Dr. Govender.
Thank you. Can you next slide, please? The first 1,000 days from conception to a child's second birthday set the foundation for lifelong health growth and development, and inadequate nutrition during the period can permanently impair cognitive capacity, physical growth, and metabolic health. Chronic malnutrition in the first 1,000 days has long-term social and economic consequences, increasing burdens on healthcare, education, and social support systems. South African Constitution strictly recognizes the rights to sufficient food, adequate healthcare, and basic nutrition for children, and obliges the government to take responsible measures to progressively realize this right within available resources. In South Africa, there are several policies that include interventions that target pregnant women, infants, and young children. However, these interventions remain predominantly facility-based and treatment-orientated. They focus on clinical micronutrient supplementations and case management while inadequately addressing the underlying household-level determinants of food insecurity, such as poverty, limited access to diverse foods, and livelihood instability. Breastfeeding practices in South Africa are poor. Exclusive breastfeeding rates at 6 months are far below recommendations, and early stopping is common, often due to maternal concerns about milk adequacy and inadequate support. As a result, many pregnant and lactating women and young children lack consistent access to diverse, nutrient-rich diets needed to meet daily nutritional requirements before clinical malnutrition is detected. This reactive facility-centered approach fails to prevent the progressive accumulation of nutritional deficits that later manifest as stunting, which we know is quite high in South Africa, micronutrient deficiencies, and compromised developmental outcomes. Compounding these challenges, climate variabilities and shocks increasingly undermine household food security through rising food costs and disruptions in supply systems, deepening nutritional vulnerabilities and inequalities. In this context, a proactive rights-grounded intervention is needed. Nutrition vouchers aligned with the WHO Code of Marketing of breast milk substitutes can improve maternal dietary diversity while reinforcing confidence and capacity to breastfeed. When implemented with skilled counseling, community support, and adherence to baby-friendly hospital initiative standards, placing the first 1,000 days nutrition at the center of the constitutional accountability, emphasizing government's obligations to protect the most vulnerable, offering a scalable, equity-driven strategy to strengthen prevention, reduce malnutrition, and advance long-term national development. The key challenges that exist is the persistent micronutrient deficiencies, particularly iron, zinc, and vitamin A, continue to affect mothers and infants, compromising maternal health, fetal development, and early child growth. Rising food insecurity driven by climate shock and inflation limits household access to sufficient, diverse, and nutritious foods, deepening malnutrition and inequalities. And gaps in breastfeeding support and complementary feeding practices result in early stopping of breastfeeding, inadequate dietary diversity, and insufficient nutrient intake during the critical first 1,000 days. So this particular intervention that we are proposing focuses on dietary diversity, improving and enhancing maternal health, looking at encouraging mothers for regular checkups for their antenatal visits. And the most important of all of this is the promotion and protection as well as support of breastfeeding. So the slide in front of you shows you the proposed intervention phases and approaches, and you can see that it's split up into 3 phases. The first phase is focusing on pregnant women, because as we all know, the first 1,000 days starts from conception up till 2 years. So the first target group is our pregnant women. Thereafter, second phase looks at our lactating mothers, that's 0 to 6 months. And this is a phase where mums are exclusively breastfeeding their babies. So our aim here is to look at the quality of their breast milk. And then the last and final phase is the 6 to 24 months. And here we are looking at promoting breastfeeding and encouraging nutrient-dense complementary foods, because after the age of 6 months, our infants are ready to start consuming additional foods. Next slide, please. So to get into the phases in a little bit more detail, the first phase we're proposing is the pregnant women phase. They would receive the first voucher upon pregnancy confirmation at a clinic or hospital. They will receive a voucher at every antenatal visit. As we know, in South Africa, women get 8 antenatal visits, and not all females attend these visits. So this voucher is trying to also encourage mothers to come to those clinics for those visits so that we can pick up how the baby is growing, if there's anything wrong with their baby, as well as looking at their nutrition. And if they attend all or go to all of their antenatal visits, they will get a bonus voucher. So if all 8 visits are complete, they get a bonus voucher. All pregnant women will receive education with this voucher, because it's no point giving somebody a voucher and if they don't know how to use those foods effectively. The proposed voucher amount is 400 Rand per month. However, when you see my example a bit later on, it's less than 400, just to show you the bare minimum we can go in terms of trying to get nutrition within this voucher. Continue to receive the vouchers while they're breastfeeding, so up to 24 months postpartum, but they have to be breastfeeding. The voucher is strategically designed to provide a spectrum of essential nutrients that target the most critical needs during pregnancy and early childhood development. The next phase is our 0 to 6 months, and the voucher is issued to the mother and not the infant, because this is to support exclusive breastfeeding. All pregnant women will receive breastfeeding education with the voucher, because as we know, many moms stop breastfeeding with the misconception they do not have enough milk, or they do not have that support they need to continue breastfeeding. So this voucher system hopes to add that additional support for the mom. Mothers include those included in the first phase of the study, first phase, which would be attending the antenatal classes, as well as mothers who did not attend the antenatal classes, but are identified at healthcare facilities when attending to give birth, with the birth certificate providing the basis for the food voucher. Community healthcare workers or the Department of Social Development staff also could identify eligible mothers, especially those that are not yet on the child support branch, because if they're not on the child support branch, they do not have anything for their babies. And they would also obviously be referred to SASA. The voucher for lactating mothers is designed to replenish maternal nutrient stores and support the quality of breast milk. And the last phase we're looking at is the infant, 6 to 24 months. The voucher is issued to the mother and has 2 components: a supplementary food for the mother if she's breastfeeding, so continued as per phase 2, and then additional complementary food for the infant or young child. Mothers identified as part of the phase 1 and 2 continue to receive their vouchers from the community healthcare workers, and additional mothers identified
Can
through
we
their
st-
enrollment.
Dr. Govender, can we start also just
Yes,
wrapping
yes.
up? You're left with essentially 1
No,
minute,
no.
but I'll give you 2 minutes.
Okay,
So
okay, perfect. Next slide, please. Okay, so this just gives you an idea of how the phases will work. Healthcare workers will identify the pregnant women, enroll them in the program. They get stamped at every visit. They collect their vouchers. And if they attend all the classes, they would get a bonus voucher. And they move on to phase 2 and 3 based on that. Next slide, please. Okay, so the role of the community healthcare worker the prime driver phase 2 and 3. So we want to identify the eligible mothers, manage the distribution, monitor compliance, train. We want to actually have training done for the community healthcare workers so they are efficient within this phases, providing breastfeeding counseling, assisting with the voucher. And next slide, please. This would be our voucher redemption that we are proposing. But what is interesting here is there has been a voucher system that has been implemented in the Western Cape, and it's the Colusa Care program, and that's what inspired our potential intervention. However, it's slightly different in the way that it doesn't only look at malnourished groups. We are looking at mothers that are food insecure. They may not be malnourished because if they're malnourished, there are special programs for malnourished moms. They can get supplements from the clinic, etc. But if they are food insecure and not malnourished, there's nothing given to those mothers to help with the nutrients for their growing child. So our aim is to target those mothers that are considered left behind as well. Next slide, please. Yes, you may also say there will be potential challenges with this intervention, and mitigating these challenges obviously would happen once we start implementing the different phases. So there might be vendor misuse, healthcare overload, monitoring impact, insufficient value, or in some instances cultural acceptability. Next slide, please. Okay, this slide just tells you why it's so important for us to have this intervention. Improves maternal health and infant development, and obviously incentivizes and supports breastfeeding, and it empowers the community. Next slide, please. So Chefs is an ideal partner because we have a consortium of experts, legal experts, nutrition experts, agricultural experts. We are multidisciplinary. We are involved in lots of national collaborations, and we have a very good operational model. Next slide, please. I'm trying to get the most out of my 2 minutes. This
Thank
just
you
tells
so
us our
much.
program recommendation.
Thank you so much.
And
You've actually gone beyond your 2 minutes. Perhaps what you can do
No
in your
problem.
in your recommendations is in your discussions with the evidence leaders, you can just speak to the recommendations. I'm going to pause here. I'm going to go to the evidence leaders. Dr. Carter.
Thank you so much, Chairperson, as well as the presenters. The presentation aligns with what we have heard here in the past few days. The immediately enforceability of children's rights, the legal parameters from which one can move. So thank you for reinforcing that understanding again here for us today. My question is actually perhaps a very narrow one. A few presentations has already indicated that buying power for mothers is very important, and that the cash in hand principle might be a better mechanism in how we address the nutritional well-being of mothers and perhaps even of infants when we look at the CSG shortfalls. Now, there's a clear positional difference in your presentation as well as previous presentations, and I love the differentiated approach, because it's certainly up to all of us to come up with proposed ideas and how we going to potentially address these concerns. Now, it was highlighted in your second to last slide on what would the potential pushback be. And mine would just to ask you to elaborate a little bit on why a voucher system in your view, because surely this has not been the first time that anyone would have pushed back on that idea. Why is a voucher system a better mechanism and vehicle to get food to mothers as opposed to increasing a grant system? And have you seen this successfully? You made reference to the Western Cape, but in other countries rolled out. And is there data that supports that the voucher system then supported the first 1,000 days well-being of the infants? Thank you so much.
All right. To answer that first question is, yes, we've got the child support grant, which is 560 Rand. However, mothers are not using that child support grant always for what it's intended. And also they have to use that for everything. It's not only nutrition. They're using it for schools. They're using it for whatever the child's needs are. The voucher system actually limits what they can buy. So my latest slides would have showed you an example of what foods they could buy with the voucher system. So there are specifically curated foods that they can select from which are nutritious. And this prevents them from taking the money and buy slap chippies or, sweets or chocolates or whatever the case might be. It makes sure that that child gets that nutritious food. So that is the reason instead of cash or having like a cash type of system, rather having a voucher system. So if you look at this on your screen, you can see there's specific amounts allocated for specific foods. And these speak to the food-based dietary guidelines, which we have in South Africa. So I'm just going to use the first one as an example. For example, energy and vitamin B12. And we've got starchy foods, make starchy foods the basis of most meals and use fat sparingly. And it gives you specific types of foods they can select from when they are going to use their vouchers to purchase. So the vouchers are very restricted to certain types of foods. The study that I mentioned in the the project in the Western Cape, they actually only curated 10 protein foods. So they identified 10 protein foods, and that's what people could only select from. And they could select from the shop, they could redeem their vouchers at a ShopRite, and it was only 10 protein foods. With our project, we felt that these are food insecure mothers and they need more than just protein for sustenance for their babies. And you would see that with the different phases, there's different foods added on, especially with the complementary feeding phase. Your other question was if there were any successful studies done. There were two studies. One was done in KZN, however, it was done on HIV patients and it wasn't done on peds. And the voucher system worked there with some flaws. And internationally, there hasn't been anything done for pregnant women and children. However, they have had a voucher system done in the UK that was successful. People actually chose the correct foods they needed to with the vouchers they had.
Thank you so much. That's really valuable. So, am I correct in then submitting that yours is to say, bringing food to the expecting mother or the infants through a voucher system is a more direct way in addressing the Section 28 obligation, whereas an increase in a social grant might be more applicable when we are addressing a Section 27 rights approach. I'm just trying to posit a
Yes,
legal
correct.
argument to say that, a physical food to mouth versus a potential food spending to mouth.
Correct.
Yes, if I may come in on that one, commissioners. Yes, it is about realizing a goal. The goal is to have healthy children, nutrient enriched diet for these children. And one way to do it, or one way to deal with the slippery slope arguments about misuse of funding or misuse of funds would be through this voucher system, where it is designated for a particular purpose. Of course, there will have to be checks and balances. No system is absolutely perfect, but it will be a learning system. We certainly, our plan has good intentions, and from the minds that we've put together, this is the way that we think it could be addressed. Prof?
Thank you so much, Doc. Prof, before you come in, perhaps you can also assist me in answering when you make your submission. Where do we place this project? Is it a Department of Health project? Because I heard you saying that it's going to be community healthcare workers, perhaps at clinic level, and then the follow-up clinics. Or is this also going to fall perhaps under a DSD approach, where there's already a food parcel process? I'm trying to come to, as you've said, Doc, the practicalities and operationality of a proposal like this. Because certainly, if it's a recommendation that the Commission wants to consider, we would like to take that into consideration as well. Prof, over to you.
Thank you very much for the opportunity, Commissioners. I just wanted to highlight that there is a child support grant, but there's no current safety net for pregnant mothers. So just to emphasize that as well. So you may consider the voucher a supplement to the child support grant once a child is born, but it's not supplementing anything at the moment in terms of the safety net for pregnant women. and the delays in the child support grant actually being issued means that there's a gap as well in terms of the implementation of child support grant. I'll hand back to Laurentia to comment about the implementation. Thank you.
I think that with the implementation, we said, I think it's both the community healthcare workers, and we did also say, for child support grants and stuff, when they are identifying those children, they will also help. I think that's DSG, if I'm not mistaken, Prof. Yes, so they would also
Correct.
be involved at a stage, but exactly who it will be, that's what we still need to develop further.
Thank you so much, team. I'm going to hand over, but I do want to have your last comment, and perhaps Dr. Bamji, you can assist me there. Throughout these proceedings, we've heard how a lack of coordination is contributing to the concerning situation that we've seen. Now, making a recommendation of who is housed with this proposal is very important to the Commission, because as my understanding is, and from what you have posited, is that the health and the well-being of the mother, and we've heard that submission as well throughout, is a very important consideration here. And when we look at that, it means that there would be a coordinating structure, yes, but also a leading department, which would be the Department of Health. Now, you have indicated that moving forward, you haven't perhaps exhausted your considerations on who would be settled with this mandate, but I do encourage you to do so. It is one of the most concerning elements that has come through this and previous engagements, that the coordination and the lack of cooperation and the fragmented approach from departments is contributing to the hunger issues that we've seen. So that brings me, if you want to comment, Dr. Bamji, in the meantime, while I'm going to hand over to my evidence leader partner. Thank you so much. Thank you, Chair.
You muted, Suhaifa?
Thank you. Yes, that's exactly where I wanted to pick up from. We have heard today and all of the days preceding from various government departments, ministers, etc., and all we hear is essentially the proverbial kicking the can down the road and lack of accountability. Ideally, and the system that we have envisaged is an entire system working together. However, as this is a pilot, we would seek to deal with something or a system that is manageable and monitorable, through which we would then be able to identify more closely, more selectively, who, and based on data, who the actual key players are, and then roll out and build on that basis. We would be seeking to look at a small site, small-ish site, if you would rather, but I'll hand over to Prof. Slotto for that.
Just to add to that quickly, the mandate falls with social development, but we would, as you would see, implement at clinics which fall under the Department of Health. And it wouldn't be effective to employ social workers at the clinics to do this. And that's why the process is aligned to where the target person is going, the mother, and she's going to the clinic, and therefore it should be provided at the clinic by the Department of Health. But as the child is aging and back in the community, there has to be a shift across through the community health workers into the social security net provided by social development. I'm not sure if the commissioners have received from the Department of Agriculture the revised draft National Food and Nutrition Security Plan, which does include this, but also emphasizes the fragmentation and puts in place enablers to deal with the fragmentation. And so that I'd refer the commissioners to that as well.
So thank you. Taking over from that, of course, I do understand the 1,000 days, and it will almost be extension backwards from the roadmap to health to include the mother from an earlier stage. And I just want to ask you specifically to assist us in the report writing. If you would also provide us with a copy of this presentation, because I really like the fact that it is within the food-based dietary guidelines of the Department of Health. I don't know why you put a limitation on specific vegetables. I wouldn't do that. I would just, any vegetables and fruits would be fine. But one can obviously speculate about that. But then we do have, as far as I know, good examples in the United States, which you haven't talked about, but where they actually do this support for young mothers and breastfeeding to encourage that. So, and if you have any, you mentioned two pieces of evidence, the Western Cape and another piece, if you can also provide that as additional to that. And then, oh, okay. And then on your, in your original submission, you also talk about economic indexation. Why is it constitutionally necessary to index nutritional support to food inflation? And what are the consequences if a state fails to do so? And I would just, I know you didn't present that now, but when I read your report, I saw you, and I was interested in what exactly you implied by that.
Prof. Soto, do you want me to start and then you add to it for me?
Go ahead, Laurentia, and then Suhaifa
Okay.
will come in.
Okay, so I think with this, what we were trying to say is that we know how expensive food is getting nowadays. The inflation price is going up, food is getting more and more expensive. And if you look at even at a child support grant of 560 rand, you can't get a basic food basket out of it. And if the price of this voucher is not increasing with inflation, they're going to get less and less food, even though they're going to get something. So that was our main reason behind it. But I'm going to hand it to Dr. Banji.
Yes, thank you. So what we also want to achieve with this, when we talk about the economic realities in terms of the constitutional perspective, we have to then note, and I'm going to put up this slide because I think it's actually germane to what we are talking about here. It is about what is immediately realizable. The economics of it will obviously have some impact, but we cannot lose focus of what is immediately realizable for children. It is the nutrition, it is the purpose and the goal behind it. So acknowledging the realities of economic constraints, the prices of goods and baskets going up and down, should not be the detractor from whether or not this can be done or whether or not this must be done now. Thank you.
Thank you, Professor Rob. If you come in, I think that will be your last comment from my side. Thank you.
Thank you. So we're emphasizing basic nutrition. So the voucher is to meet Section 28. And it's not a voucher that is trying to do everything that we would like to do. And the foods that are listed, we visited sources of food for people, particularly that are not, that don't have easy access to supermarkets and things like that. And the local supermarket in a rural area is limited in terms of vegetables. And so the list that is provided is a list that is compatible with what people are likely to access and is aimed at meeting those basic needs. So that maybe answers your questions about all vegetables as opposed to specific ones. The inflation issue is one about continuing to meet basic nutrition. In other words, that we're not eroding that minimum benchmark level that the Constitution requires us to arrive at. Thank you.
Hand over to you. Thank you.
Thank you so much. I'll start with Commissioner Kwinana. Any questions? Commissioner Ntuli, any questions? Right. Perhaps let me just ask one question from my side, and I think it goes to the question that was asked by Dr. Carter, the vouchers versus the cash on hand for mothers. I think it is the universal income, quali- acco- so and maternal support grant. So there are two organizations that came before the commission. I can't remember their names to the T. Their argument was that instead of giving mothers vouchers, we need to give them money in order for them to be able to make choices, but also not to support big corporations, as well as ensure that informal traders are not left out of the process. How would you, and I'm noting that your emphasis is on the voucher process, how would you then perhaps recommend a middle way for the commission, or is alternatively, because we're talking about maternal support or the first 1,000 days, the voucher would be the best option?
So with the vouchers, we weren't looking at big companies. So when we're looking at the vouchers, we are looking at where the people who need it the most are, and we were going to actually look at vendors in those areas, so even the informal vendors within those areas, to cater for that. So I think that answers the one question you had. But Rob, do you want to add to that?
Maybe just to add, with electronics, small and medium enterprises can engage with this. The idea is that the community health workers can identify and verify a vendor in a particular area and facilitate that vendor enters into the voucher system. Because it's not only about big business, it's about people in rural areas not having access to any food distribution network other than informal vendors or small companies that are in rural areas. Thanks.
Thank you so much. Oh, I see that there's a hand by Prof. Perhaps let me just make this, because I'm looking at time, in terms of the further written submissions. Perhaps you can broaden this conversation in terms of how it would look when we are using vouchers vis-a-vis how it looks when mothers have cash on hand, and in that respect. But also there has been a request for research in terms of the project in the Western Cape province, as well as perhaps the Western Cape province's research in terms of the use of vouchers and how it was successfully done. I know that there was also mentioned that it was also attempted to be done in KZN, but not for mothers, but for HIV positive persons. Perhaps we can just have that research and see where the difficulties were in KZN. And then any further submissions that you'd like to make in terms of your deliberations with the evidence leaders as well as the panel. Thank you so much for waiting patiently. We know that you had to start at 9 o'clock, and we do apologize for starting very late and behind our schedule. But also thank you for making your written submissions and availing yourself to making oral submissions. You are duly excused. The supplementary submissions are requested on or before the 6th of April, 2026. Thank you.
Thank you.
Ladies and gentlemen,
Thank you, Commissioners.
it's 1:10. I'll ask Ephraim if we can go collect the minister. We will hear the oral submissions from the Minister of... So the program has slightly changed, and I do apologize to the representative from Section 27. We will have the Minister of Planning, Monitoring and Evaluation now. We will then break for a 20-minute lunch break and then come back to proceed with Section 27, the Child's Institute, the Minister of Social Development, the Minister of Basic Education, and then we will then have closure of the inquiry and a way forward. So those are the adjustments to the program. Thank you. Apologies. I'm trying to understand what is happening. I see that people are walking out, and I'm trying to understand what is happening. I don't know. Colleagues, we advise that those who are attending physically are asking for a water break, so we will excuse them, but we'll proceed with the inquiry. Can I ask that we, one, move out speedily, respecting that the proceedings are still taking place, respecting that someone is actually on the podium, and doing it in a way that does not cause disruptions, because this is very disruptive. Thank you so much. We are now going to then proceed with the Minister of Planning, Monitoring and Evaluation. Good afternoon, Minister. Just for the records, for those who do not know who you are, brief introduction as well as the support team that is here, as well as the role that they play in your department. Thank you.
Thank you very much, sorry, esteemed commissioners. My name is Marupini Ramokhupa, and I am the Minister in Presidency responsible for monitoring at DG, Mr. Mdlalose. This is that we're here with an our team. Thank you.
Thank you so much, Minister. I note that we don't have your presentation. Will you be making a presentation, or did I miss that part as the panel?
Thank you very much. I will be making a presentation that I will be reading. My apologies that you did not receive it. If the panel or the commission may allow me, I would like to go through the presentation that I have prepared here, based, of course, on the written replies that we have sent to the commission last year when we were actually asked to do so by the commission.
Okay, thank you. So it's in line with that written submission. Okay. Minister, may I then ask for this process in terms of swearing you in or affirming you in, if you can kindly stand, but also then those who will be providing you with support in answering questions, they can also then follow the same process. Full names for the record once more.
Marupini Lydia Ramokho.
Will you be taking the prescribed oath or affirmation?
I'll take the prescribed oath.
Do you consider the prescribed oath to be binding on your conscience, Minister?
Yes, I do.
Do you swear that the evidence you're about to present before the commission is the truth, nothing but the truth? If so, raise your right hand and say, "So help me God."
So help me God.
Thank you. Minister, in terms of your officials, are you going to be assisted? I see that he's already standing. You may sit.
My name is Melanchthon Philip Malepe Makobe.
So you'll be taking the prescribed oath or affirmation.
Prescribed oath.
Do you consider the oath to be binding on your conscience?
Yes.
Do you swear that the evidence you're about to present before the commission is the truth, nothing but the whole truth? If so, raise your right hand and say, "So help me God."
So help me God.
Thank you. Full names. You have. I've sworn you in. So actually, I'm supposed to have warned you and your colleague that you can. Yes, I remember yesterday that you consider. Do you still consider the oath to be binding on your conscience?
Yes.
Thank you so much. You have been sworn in, so you don't have to take another oath. I see that your special advisor won't be providing any technical support in terms of answering questions. Okay, thank you. Minister, you may proceed. You have 20 minutes. Thank you.
Thank you very much, your esteemed commissioners, Commissioner Sandra Makwasha, Commissioner Pili Lentuli, Commissioner Noma Hlubi Kwinana. Good afternoon, let me take this opportunity, of course, and thank the Commission for giving us this time and allocating this time after we were not able to be present yesterday. We really appreciate the pardon of the Commission. The core mandate of our department, which is Department of Planning, Monitoring and Evaluation, is to do the following. The first one is planning, where we are responsible to institutionalize the planning of the country from long term through the National Development Plan to medium, and the second one would be the medium term, which will then now be done through the medium term development plan, and the short term one, which will be planning through the annual performance plan of different departments, which of course we monitor and ensure that they are aligned to the medium term development plan. We also do the monitoring part, whereby we monitor the implementation of the MTDP that I've just spoken to, which is the medium term development plan, and we would then now be able to give evaluation of the impact of the performance of government as it relates to what has been agreed upon for the 5 years term, which is an administration of each and every government. In this regard, it would be the 7th administration. Distinguished commissioners, we note, of course, that although food may be available, it is also not easily accessible to everyone in South Africa. As a result, we do note that food should be both available and accessible. But it is also time that we deal with the issues of nutrients required to nourish the bodies of people, most especially young people, as well as women and the broader society. Throughout our work of DPME, we ensure that food security find expression in all the planning of documents in government, and I've already explained how we do that through the issues of MTDP. Furthermore, we continue to ensure that we monitor biannually in terms of what the departments are actually doing, and we report to cabinet in relation to the assessment that would have been able to do from those particular departments. But equally so, in every 5 years, we do take out an NDP or NPC assessment, which we call a review. Sometimes we do it every 10 years to say that this is where we are as it relates to the implementation of our long-term vision, which is called the NDP. We also have a process that we do, we call it outcome facilitation, that we do for the president and the deputy president of each and every department. And we then use the APPs of those departments, but we also use the agreement that the president entered into with the ministers and the deputy ministers in terms of performance. But we also utilize, of course, the MTDP as well as the commitments that the president might have done during the SONA. Equally so, we also facilitate and coordinate what is called voluntary national review of the UN, where we are able to align our NDP and the SDGs in terms of the country's performance. Of course, not many countries are doing it in the world, but we do it periodically, and we also report to the UN sphere as it relates to how South Africa have been able to perform as it relates to the SDGs. We would like to, of course, bring the Commission to the following submission. In terms of our strategic oversight of food security, we as a department have been able to ensure that national planning and performance framework integrate food security and nutrition, and we do that by utilizing the MTDPF, I've already said, with clear performance indicators that are measurable and reported on a biannual basis, as I've already said. Of course, our department further ensures that the security that we need find expression in all official documents that we have. In terms of monitoring and evaluation of programs, what we do, we integrate monitoring, and we also make sure that we use those mechanisms to monitor government programs related to departments such as agriculture as well as social protection, but we also look at health and nutrition. But we do that in ensuring that in terms of the annual performance that I've already spoken to, we utilize what we call an EQPR, which is an electronic version of ensuring that whatever it is that we are doing and we are collecting on a biannual basis based on the quarterly reports that we get is actually stored, and we look at it and analyze its validity as a result. Of course, there have been a number of things that have been in place. For example, our department had called for a national food security and nutrition plan that, of course, ended in 2023, which we led, as I've already said. Of course, this was based on a theory approach that was adopted to evaluate the plan, considering the interconnections and interreactions within the food and nutrition systems of our country. The evaluation that we did, of course, recommended a number of interventions that were necessary, and they were supposed to actually strengthen collaboration as well as involving all stakeholders that are needed, not only in government but also in private sector. Of course, a new plan for 2024 to 2029 will be led by the Department of Agriculture now that we have put the systems in place in the first plan that we had put in place. We have been asked, of course, about the data and evidence in terms of our reporting systems. We utilize the data that we collect from all the departments and stakeholders. And in this regard, we usually use the Stats South Africa, but we also use the United Nations agencies like Food and Agricultural Organization. We also use United Nations Children's Funds, World Health Organization, United Nations Educational Facilities, as well as the Scientific and Cultural Organization. Of course, we work together with all the structures of the United Nations or the agencies that we believe that are actually assisting us in order to get the data that we need. Of course, these international indicators that we gather are adapted to local condition, and others can call it domestication, and we use them to guide intervention in decision making, as well as making sure that we direct departments in order to ensure that whatever it is that is happening must be based on that. But equally so, I've already said, we do escalate matters if they are not implemented to cabinet through our biannual performance reporting, and to the president during what I've just spoken about in terms of outcome facilitation. We've also been asked, of course, about interdepartmental coordination, how we do it. The structures that we are using are the interministerial committees that are set up by the president, but we also have what we call a cluster system in cabinet, but also cabinet committee. Department have been able to see a number of interventions that were successful, but some we're still working on them. For example, we've been able to see more nutrition-focused training for community health workers, but we have also been able to see early childhood development centers and community nutrition and development centers growing, but we've also been able to see an increase in terms of focus on expanding the coverage of existing nutrition-specific programs. The biggest game changer in this regard are the assumptions of responsibility for nutrition improvement at the highest levels of government, and the development of processes to help those leaders that are coordinators to put action and also to monitor progress in and making adjustments where there is a need, but most of all, to actually ensure that we do have accountability. In terms of the issues that were raised on loops and accountability, we do have, as I've already spoken about, the issue of IMCs and outcome facilitation, and we really do believe that in terms of the loops that may have been there and accountability that is needed, if we find that there are gaps identified during monitoring of plans and other development that are needed, we ensure that we utilize those structures that I've already spoken about. Of course, improved target setting and data collection for the impact targets that is needed is also part of the things that we put in place, but we do that by incorporating existing legislation mechanisms as well as intergovernmental coordination to actually be put in place. In closing, so that I don't take so much of your time, we must then now be able to say that in terms of the issues of consequence management. Of course, we have to do everything within the prescript of the law. We don't hire directors, we don't hire, also don't appoint ministers. However, we go to cabinet to be able to report to cabinet with the president in terms of what we would have raised as issues that need attention from the president or from the department itself. And we are, what would be what say in this regard in terms of our work as a department, nation of planning, as well as monitoring and evaluation of policy and programs of government. Thank you.
Thank you so much, Minister. You actually went to 20 minutes. So usually ministers take beyond 20 minutes. So thank you so much. We can tell that you're from planning. I'm going to ask the evidence leaders to ask a set of questions, 20 minutes still, and then we'll take it from there. Thank you.
Thank you very much, Honourable Minister and your delegation. Thank you for your submissions and also for your feedback today. So I just want to ask regarding the new proposed planning and monitoring and evaluation bill, would that grant the department more to improve the accountability of departments that are consistently their food security targets? And what are the proposed consequences for such non-compliance? On the first hand, as part of the bill, and then secondly on the bill as well, how will the new bill aligned with national food? How will all the department going to monitor this alignment?
Okay, thank you very much. Of course, we really do believe that the bill will assist us to be able to put in place what is needed in terms of ensuring that we give directives to other departments to be able to do what they need to do, including giving directives to departments in provincial level, but also find a way of giving directives that, for example, what Treasury would be able to do in municipalities. If you can look at the current landscape that we have now, there are some other systems that are there that national government can be able to intervene on, but there are others that we may not be able to intervene on, and those are transversal issues. But also when you then now go to local government, even if you intervene and you are not utilizing what is in the Constitution or the other acts that are there, like the MFMA and Structures Act, the intervention that you put in place may just be what you may be able to do. However, it is not legally binding. So we really do believe that this bill will be able to give us directives, just like the way that Treasury would be able to intervene, or COCTA would be able to intervene in other departments on a provincial level as well as in local government. But also for us, we would like to get the powers to be able to give directives that would hold other departments accountable. At the moment, of course, we are utilizing the executive authority of the president because we are in presidency. As a result, when the president sits with ministers and do the performance agreement, we are also involved in them. The review of those performance agreement, it is us who would then now facilitate the work that has been done, that the president would then now utilize to engage with ministers. Therefore, when we then now indicate that this hasn't been done, directly the president is able to ask that with ourselves on the side making that presentation. So, but we do believe that the bill will allow us to do that immediately instead of waiting for the processes where the president will be engaging with the departments that are under him, of course, in terms of ministries. In terms of ensuring that the intergovernmental relations is also adhered to, in utilizing, of course, the legal prescript that would allow us to enforce some of the directives that we would have given, we believe that this bill will come in handy. Because at the moment, sometimes even when we have to go and intervene, we can go in analysis, utilizing what we call frontline monitoring. At the end of the day, we would still then now have to go to Treasury and COCTA to say that legally it is you who have the instrument to be able to intervene. So in our view, this bill is actually crucial to be passed as soon as possible for us to be able to do what we need to do effectively. So, thank you.
Regarding data gaps, as you admit in your submission that there is a paucity of data on key missing food security and nutrition indicators, such as stunting and micronutrient deficiencies, that are collected routinely rather than sporadically. So, may I remind you, we are supposed as a country to report on a yearly basis to the United States regarding United Nations regarding this. And do you not suppose that a specific ring-fenced budget may be an option to make sure that we can fill in those data gaps that are constantly we being reminded of in those international platforms, that South Africa is not providing that data on a regular basis?
I do believe that collection of data, of course, need us to be able to have a budget, but at times to utilize what we already have. What we need is stronger coordination. In the past, we used to have what we call development indicators that would give after every 5 years. We have soon taken a decision from this financial year that we will do it yearly. That would assist us then to be able to first get a cabinet approval, and we would then now utilize what I've just spoken about, which is the voluntary national review of the UN, and utilize the development indicators that we have annually to be able to report to the UN systems in time. So we are aware of that, and we have already put in systems in place to address that, so that we can be able to ensure that whatever it is that we are doing, we do it effectively and also on time.
So regarding vulnerable groups, and this will be my last question to you, is as the oversight body for national planning, how is your department monitoring the impact of food price inflation on the affordability of a right to recommendations have been made to regulate corporate practices that may be hindering access for low-income households?
I will just ask my outcome facilitator to give more into that. As we've already said, when we come up with an MTDP, we do a modeling that we utilize, of course, institutions such as the Stellenbosch research, but we also utilize other structures that are in there that would be able to give us the data that we need to be able to deal with that. It is for this reason that our second priority is actually dealing with exactly that, the accessibility of food, and also ensuring that the prices are actually also in line with what our people can be able to afford. It is the second priority that we are utilizing, making sure that when we monitor in terms